Patients come into the office with varying injuries, lots of questions associated with things that they can do past their healing time that incorporates lots of protection. I think everybody worries about having an injury that repeats itself, something that becomes chronic, something they can't get rid of. There are a lot of layers to answering that kind of question for patients, but we incorporate tremendous layers and components to the education part of physical and occupational therapy at MMI in order to give patients the most comprehensive and the most helpful future in getting over their injuries and then looking toward things that they're going to do differently to make themselves better and to sustain their wellness. Many of the things that we think about incorporate just very basic ideas. Posture tends to be one of the big components we hear every therapist talking about in the office. Using your trunk and your large muscles basically to protect your joints. If we support things with our large muscles and our trunk and core, you'll find that the distal muscles, or the fingers, the wrists, the elbows, and even your shoulders will be much less painful and less likely to sustain injuries. So an example, which is very similar to our day-to-day activities, would be something like carrying. If you carry things close to your body, like a paper bag, you're using all of your key large muscle groups to do that lift. When you're using plastic bags, and we're all famous for feeding lots of plastic bags on each arm and then carrying more weight, you're more likely to sustain injuries, you're more likely to strain. So we try to incorporate these types of educational components in asking patients to think a little bit ahead, to try to plan things differently, to consider some of the injuries that they have as an opportunity to make changes, and those changes incorporate a broader, more comprehensive wellness package for them. Using physicians and assessing your fitness level, in addition to addressing individual problems of pain or injury, are all something that we enjoy working individually with patients. So consider getting a consultation at MMI and in physical or occupational therapy to address some of your wellness problems.